Hey guys, I'll get the meeting started in just a few minutes. I'm going to let some people into the waiting room and we'll get started in just a few minutes. Looking forward to talking with you guys. You down here?
I'm right here, but I don't know how to get on.
Hey, you guys, Dr. Haverland here. I'm just going to give a few more minutes to let some more people in, and then we will get started with our webinar. Thanks for meeting with me today. Looking forward to talking with you guys for the next hour or so about endometriosis, about surgery, kind of what to expect after recovery, and just answer some questions. So I want this to be interactive. So please feel free to use the sidebar to ask questions. I'm here talking for the next hour, and it's nice to have some feedback or questions that you may have of something that I discuss doesn't make sense. Let me know. I want this to be informative, really for everybody involved. And every month that we do this, we start to get more and more patients and more people starting to learn about endometriosis and learn more about the disease itself and how it affects. Sometimes it's partners, husbands, sisters, wives, or sometimes it's patients themselves just wanting to learn more and advocate more about some of their symptoms. And so I'm looking forward to talking to you guys for a while about this. So I'm going to give a few more minutes to let a few more people join, and then we will get started. Hey guys, Dr. Haverland here. Um, if you haven't heard me yet, I'm just waiting for a few more people to get started and join. I am the owner and surgeon at Endometriosis Center of Excellence, located here in Dallas, Texas. We're not going anywhere. We are a new practice, and we are excited to start treating not just women of Texas, but women really all over the country and around the world, just educating on endometriosis and trying to help people learn more about it. Our webinars are becoming more popular, which is really exciting. And not just for patients, but we're also starting to see husbands, family members, sisters, other partners, just people that are wanting to try to understand more about their loved ones are going through, and learn more about endometriosis. And it's really exciting to watch this grow and trying to educate patients more on endometriosis. So um, I'm going to be talking with you guys for the next hour or so. I would love some feedback in the chat. If you have questions, if there's something that I'm discussing that doesn't make sense, or things that don't that you don't understand, or just personal questions, just shoot me a message. I won't be able to get to all of them, but I'll try to scroll through, intermittently and be able to answer questions so that this can be more interactive. So I'm letting a few more patients into the webinar here, and then we'll get going. So some people that are here are my prior patients, which I'm so honored that you came back to learn more and to talk about endometriosis. I'm very, very passionate about this, and I don't know everything, but I think we're all learning more. Some of my patients know just as much about endometriosis as I do, because they've had to, advocate for themselves and try to educate themselves on some of their treatment options and treatment plans. And so I see some of my old patients in here, which is really fun to see. I see patients maybe I've had consults with, and again, partners, wives, husbands, and then someone asked, is this going to be recorded? So we are recording these, and we may start uploading them on YouTube. At least snippets and portions of these are going to be uploaded to our like social media, like Instagram or Facebook, so that you can see some of the highlights. And so today is really an important topic, because this is something that isn't discussed as much. We talk a lot about endometriosis, but we talk about surgery and how to treat the underlying cause and the underlying course, but we don't always talk or have time to talk about as much about postoperative expectations and recovery from surgery. So, you know, the one thing that we talk about, why post-op surgery pain, fatigue, setbacks may not be a red flag, and what you can do to heal faster and more confidently. And it is important to talk about expectations after surgery, what that's going to look like for you. What does your pain resolve immediately? Does it take time? So many women go into surgery hoping to finally feel relief, and then afterwards they feel confused, exhausted, and anxious. So this webinar reveals what recovery really looks like, why setbacks do not mean failure, and how to create a healing plan that works for your body and your life, a very individualized treatment plan, because everyone responds differently to medications, to surgery. And it's important to have understand your expectations, but also to understand what it should look like. So if it's not on the same trajectory, that you can reach out and find help. So by the end of this webinar, you'll know what to expect after endometriosis surgery from day one through long-term healing, and how to take control of your recovery process physically, emotionally, and logistically, because there's a lot of moving parts. I usually say that this is a marathon, not a sprint. So if you've been afraid to get surgery because you don't know what comes next, or you've already had surgery and you still don't feel normal, you're not alone and you're not doing it wrong. But we can certainly help you in this process. We want to explain this without scary medical language, just honest, expert-backed advice so you can recover with confidence and not confusion. So I am Dr. Rachael Haverland. I am the owner and surgeon at Endometriosis Center of Excellence. We are almost a year old, which has been really exciting, and we have been able to help hundreds of women with endometriosis and this debilitating disease. We are learning more together about the disease, learning more treatment plans. But I am just a huge advocate for women's health, but especially when it comes to endometriosis. It is very underserved. It's very under-resourced as far as education and research goes. And I want to be your biggest advocate. And I'm not perfect. I don't know everything, but I want to share with you the knowledge that I do have. And so that you can advocate for yourself and also understand more about the disease. So through these webinars, every month we go over a slightly different topic. And again, today we're going over a topic where we talk about sort of postoperative recovery, what this looks like, what to expect after endometriosis surgery, and if your pain is still present, does that mean we failed, or what are next steps? And so I want to talk about kind of expectations after surgery, what to do if you do continue to have pain, and what we should do for next steps going forward. Again, I'd like this to be interactive. If you didn't hear me before, I'm sort of talking to myself for the next hour, but if you have questions in the chat, I would love for you to ask individualized questions, or if I explain something that doesn't make sense, please feel free to put your questions in the sidebar in the chat so we can go over it. Okay, so, we have a lot of patients here. I'm looking through. I'm seeing some of my older patients that have had surgery with me before. I'm seeing some patients that have some upcoming consults. I'm also seeing partners, friends, and families of patients that are coming here, hopefully to learn more about endometriosis, and I think that's really special. It's important to try to comprehend what our loved ones are going through so that we can better care for them, better understand what they're having to endure, but also try to better understand ways to help them, especially if they feel like they can't help themselves. All right, so we're going to kind of jump in to this webinar talking about expectations. So what if I told you that the hardest part of surgery isn't the procedure itself, it's the recovery? And nobody talks about it. I talk about this all the time. Endometriosis treatment plan is a marathon, not a sprint. It is not surgery alone. Studies show that up to 40% of patients feel unprepared post-surgery healing, and some even think the pain means that surgery doesn't work, and that's absolutely not true. So I am Dr. Rachael Haverland. I'm a board-certified gynecologic endometriosis surgeon specializing in endometriosis excision surgery. And at this point, at the Endometriosis Center of Excellence, we have already helped hundreds of women, recover from endometriosis excision surgery and build the life that they were promised, but they never got. And my goal is to treat as many women as I can. This is not a one-size-fits-all, and surgery certainly is intimidating and not the first choice for everyone. But I hope by the end of this session, you'll understand the full recovery timeline, how to navigate physical and emotional shifts, and what it means to heal right. And if you stay until the end, I'll send you my post-recovery timeline and symptom tracker to help you stay empowered every step of the way. So again, here at Endometriosis Center of Excellence, we do try to use a multidisciplinary approach. We are treating endometriosis from all sides, from anywhere that we can, to treat the inflammation. We talk about diet, we talk about exercise, we talk about physical therapy, pelvic floor physical therapy. We talk about acupuncture. We talk about hormones. I think it is important to at least have this discussion of hormones. Hormones are not for everyone, and sometimes their side effects are debilitating, or some people just don't want to take hormones, and that's okay. You're not required to try and fail every type of hormone that's present before you get the treatment you need. But I do think it's an important part of the discussion, especially when it comes to adenomyosis, which is so commonly prevalent also with endometriosis. And so during this webinar, we're gonna keep going through surgery. So even though at this practice at Endometriosis Center of Excellence, we do very much have a multidisciplinary approach and a well-rounded approach, but today we're going to talk about surgery and what the postoperative recovery looks like and expectations. So first, your recovery timeline. What is normal and what's not? There's a misconception that I'll be back to normal in a few days. So the realistic recovery is that these first few days after surgery are the most difficult. The first 24 hours after surgery, your body is in a stress response. It is in stress mode. You have cortisol release. Your hormones stress out, even your other hormones outside of the cortisol are in recovery mode, your fight or flight. And so that first night is usually more difficult. You may have some anesthesia side effects. Some people feel nauseous, some people feel dizzy. The pain is usually more severe that first night. With surgery, I always use long-acting numbing medication that lasts for 72 hours. It's similar to a pain pump, but it's not as invasive since it doesn't have to stay present. It just takes a while for your body to reabsorb it, so it lasts for 72 hours. I also give my patients nausea medicine so that they have these tools when they're feeling nauseous at home. I also give them 3 different types of pain medicine so that you can kind of titrate up your pain medicine as needed. But usually that first 24 hours is the hardest as far as recovery goes. And some of that's related to stress response from surgery. The next milestone after surgery is about 48 hours. So first is the first night, then the next milestone is 48 hours. And at this 48-hour mark, usually the worst part is behind you. You're going to start feeling a little bit better every day, hopefully a little bit more mobile. Urinating is a little bit easier. You may start to pass gas or have bowel movements, and that certainly helps with some of the bloating and the pressure in your abdomen. One of the hardest things after surgery is that you have to urinate. We have to prove that the bladder is still awake, that it's responding to emptying when we ask it to, because sometimes the anesthesia can make it sleepy or tired where it doesn't constrict as well. It's also hard to relax the urethra or those other aspects of avoiding and emptying the bladder. They could be inflamed. And so the first few days after surgery, your bladder may not feel normal. It may burn or sting to urinate, but that does improve. Usually by day 3, you're passing gas from down below. You're starting to have some bowel movements. Hopefully we've worked on taking your laxatives throughout the first few days after surgery. Fatigue is very common. In fact, it's one of the last aspects of surgery to fully resolve. Fatigue is your body's way of saying that it needs to rest, it needs to heal. And a lot of women with endometriosis see this at baseline, even without surgery. But after surgery, it's especially prevalent. Fatigue is most common in the first few weeks, but it typically is the last side effect from surgery to resolve. Sometimes 4, 6, 8, even 12 weeks to really let that fatigue resolve back to baseline, hopefully better than baseline. That is our goal after surgery, is not to get back to baseline as we were before, but hopefully improve from baseline. So after you're able to exercise and get back into physical activity, we really start pushing that because that helps resolve the fatigue a little bit faster. Bloating can be incredibly prevalent after surgery. Almost all patients feel some sort of bloating after surgery. Some of that is fluid retention from the IVs. Some of this is just swelling in the pelvis from the areas that we dissected, whether it's a hysterectomy with the uterus or the endometriosis excision. Either way, most people feel at least some bloating. Anesthesia and also the pain medicines also slow the contractility of the colon. And so most people do feel somewhat constipated after surgery, which also contributes to the bloating. I start my patients on laxatives pretty immediately the next day or 2 after surgery so that the constipation usually is a dull roar or at least managed. But the constipation also contributes to the bloating. Next, we see pain fluctuations. So sometimes, the pain is worse for a few days and then it gets better. And then you start to see your pain, spike again, at a week later or 2 weeks later. And that doesn't mean that surgery wasn't successful. It just means that your nerves are firing. Your nerves are starting to wake up. They're starting to heal, but they're still feeling this inflammation. It could take up to a year for tissue remodeling. So after we remove this endometriosis, it's hard to wait, but we have to let our bodies regenerate. And this tissue remodeling can take up to a year. Nerves heal incredibly slowly. They heal 1 to 2 centimeters a year. So when the endometriosis is affecting these nerves, sometimes it takes a long time for these nerves to to recover, to relearn their response to different triggers. That comes with like the central sensitization of pain and the hypersensitivity of pain that also comes with endometriosis. So it's very important to kind of understand that this process that, especially at the beginning, just because your pain isn't completely resolved by 1 or 2 months, this does not mean that surgery was a failure. It just means that we need to continue to decrease that inflammation to let those nerves heal. So I had a patient that panicked on day 10, then she felt worse on day 10 than she did on day 3. And we talked to her about this. This is a part of a normal healing curve. Sometimes at day 10, you're a little bit more active. You're moving around more. The next day, your muscles might be responding to that activity, like a little bit more spasms or heightened pain. You can have a quick flare as your nerves are recovering and responding to surgery. And so recovery is not linear. And understanding these phases will help you feel empowered and not afraid. Again, surgery, endometriosis treatment in general is a marathon and not a sprint. It is important to understand your body. It's also imperative to know that this is not a one size fits all. Not everybody's treatment plan is the same. Not everybody responds to the same treatment, and not everyone recovers after surgery the same. And I also think that it's really important not to try to compare yourself to others. Well, my friend who had surgery, she was completely normal within 2 weeks. Well, that's not the case for everybody. Not everybody has the same endometriosis in the same locations. Their body hasn't been through the same inflammatory responses. And it's not a weakness or a strength that you recover quickly. It's just how your body's responding. And I want to hammer that home, because patients that may need pain medicine longer than other patients, that is not a failure. That does not mean that you have a low pain tolerance. It just means your body responds differently to inflammation and surgery, and your body needs more time to heal. Your pain receptors are more sensitive, whether it's because they've been damaged with endometriosis for so long, or because you have that hypersensitization of pain due to this chronic inflammatory response that endometriosis brings. It is important not to compare yourself to others, because again, endometriosis recovery is very different for each person. And giving yourself grace as you're healing is very difficult, because anybody, all of us, me included, we like to see immediate responses. We want to see a positive response from something that we tried or something that we worked for. And while we all want to see that, including myself, you have to give time. Once we remove the endometriosis, remove this underlying cause and this inflammatory response, we have to let these tissues heal, let the nerves heal, retrain the muscles with pelvic floor physical therapy. Treat our bodies better than it was before. Try to work towards decreasing the inflammation, rather with diet, starting to increase exercise so that we see that physical and also emotional benefit. But also just give us time. And time is really hard, again, because we all want to see this immediate positive reinforcement. And I have some patients that do, but that does not mean if you don't see that immediate response that you're not going to be successful with surgery. Anyway, so that is kind of the first discussion, is your recovery timeline, what's normal, what's not. Things to look out for in this first week, especially, is a fever. If you have a fever over 100.4, that is something you should reach out to. That's not normal. That's not something that you should expect. Also, with nausea and vomiting. If you are nauseous a little bit after surgery, that's pretty common, but it shouldn't get better and then worse again. So usually if your nausea resolves by day 2, 3, or 4, but if you're having vomiting that's uncontrollably around, at the end of the week or 10 days, that's telling me that there may be something going on. You could have something like an ileus, where the bowels have kind of stopped peristalsing, or you could have an infection. And so those are things that are especially important to look out for after surgery, and reasons to call your surgeon. I give my patients my personal cell phone. Not everybody does this, but it's important to me. I want to make sure my patients are safe. My goal in my career is to help women with endometriosis, try to have a better quality of life, whether it's getting pregnant, rather it's improving their pain, rather it's just longevity and preserving their ovaries and their ovarian function. I want to help. And so I give my cell phone out to my patients after surgery so that they have access to me. I want to make sure that if there is any complications that we catch it early. But those are the most common reasons that I request patients call me. One is a fever, or if they've had new onset nausea, vomiting. All right, so I'm going to go over to the chat here and see if there's any questions or comments that I can go over. Again, thank you for commenting in the chat so that I'm not talking to myself the whole time. One of the people in the chat said, I'm at 6 weeks post-op and I'm still exhausted. And that is very common. At 6 weeks though, you can start increasing your activity. And that's usually what I recommend to help the fatigue resolve faster is increasing your activity, your stamina, rather pushing towards with cardio, increasing your weightlifting, or if you've never exercised, starting to exercise, starting to push yourself, and push yourself a little bit further each day. That day you'll be tired and more fatigued, but it'll help you in the long run, getting back to your baseline stamina and hopefully a stamina that's improved so that you can really take care of your body through exercise as well. And that's very, very difficult for patients during chronic pain, to exercise, but there's been a lot of benefits with exercise. And so if we can implement that into our treatment plan, many women have seen a benefit. Most of my patients, most of my surgeries are outpatient. And I see that in here in some of the comments and the questions. So yes, most of my patients are able to go home the same day. That long-acting numbing medicine that I use that lasts for 3 days certainly helps with pain control afterwards. It helps with them being able to eat faster, walk faster, their bladders to improve, to start to function. It decreases their risk of having urinary retention. And so the pain medicine that I use as a long-acting injection certainly helps with that postoperative pain. And then my patients that go home, they have 3 different types of pain medicine as well as a nausea medicine, so that essentially every medicine they would have in the hospital, they'll have at home. I never kick my patients out. If they don't feel comfortable going home, of course they can stay the night. I want to make sure that you feel comfortable. And again, this is not a one size fits all. Another reason why I have my patients go home is it does show decreased risk of infection, because the hospitals, you can have infections from other patients or other areas in the hospital. It decreases your risk of blood clots, because when you go home, you tend to walk more rather than just sit in the bed at the hospital, and also decreases risk of pneumonia. And so the reason I send patients home is not because I don't want them to stay in the hospital. There's actually true proven benefit for going home, because you do tend to move around faster and move more, which decreases a lot of those postoperative complications. All right, so let's see. So talking about if you've had surgeries before, so you've had an endometriosis surgery before, and you're a year out and you're still having pain, what do we do? And so that's one of the questions here, and I want to make sure we go over that. But one, it's important to make sure you're doing this multidisciplinary approach, that you're treating endometriosis from every aspect that you can to decrease that inflammation. And then secondly, we talk about your surgery. I am very aggressive in removing the endometriosis. I literally look at everything in your abdomen and pelvis and feel comfortable removing endometriosis from wherever we find it. Your diaphragm, your small intestine, your colon, your appendix, your nerves, your vessels, your ligaments. I want to make sure that there's no visible disease. Even with, advanced endometriosis training and excision, there are some women that have endometriosis recurrence, even women that I've done surgeries on, and sometimes their endometriosis is more aggressive for whatever reason. Women that have a first-degree relative have a higher risk of having endometriosis be more aggressive, that aggressive subtype. But the first thing is to look at your surgery. Did you have a true excision? Was endometriosis performed? I had a patient I saw yesterday actually where she was told she had excision, but they only removed 3 specimens. And so I don't, in my personal opinion, I don't think you can do endometriosis excision and be told it was stage 3 and only remove 3 areas, because endometriosis is likely present outside of those areas. So one, you have to be able to identify them, and two, feel comfortable excising them and remove the endometriosis aggressively. And so even though she was told she had excision surgery, I don't think her excision surgery was as aggressive as I would have performed. And so her likelihood of recurrence is much higher. So talking about the surgery itself, and if the endometriosis was completely excised, all visible disease was removed, I think is an important first step, but also using this multidisciplinary plan. All right, so next we're going to talk about, you know, endometriosis and how you recover after surgery is very independent. Not everybody, responds the same to surgery. And so we talked about, recovery timeline, what's normal, what's not. Remember, recovery is not linear, and understanding the phases will help you feel empowered and not afraid, when it comes to surgical recovery. So our next kind of insight is managing pain, hormones, and healing beyond the prescription. So the misconception is, I still have pain and the surgery didn't work. That is not the case. So endometriosis excision surgery is incredibly complex. So these cells that are similar to the endometrium are implanted elsewhere in the body. They can be on your nerves, they can be on your ligaments, they can be on your muscles, they can be on your vessels. And so it's very important, one, to be able to identify the endometriosis, and two, to remove them. When we do this excision, this is deep dissection into the peritoneum. So this can inflame multiple areas. Most women that I do surgery on do not just have superficial endometriosis on the peritoneum. It's almost always deeper. And if you don't look, you're absolutely going to miss it. And so this inflammation from surgery affects the nerves. And like I mentioned before, the nerves heal very slowly. Tissue remodeling after surgery can take up to a year. Nerves heal 1 to 2 centimeters a year. And so the nerve pain that you feel, this sharp stabbing, shooting pain, sometimes takes time to recover, to let this inflammation around the endometriosis resolve. Sometimes there is chronic long-term damage from the endometriosis. Even though we go in and we remove the endometriosis, that we can see the nerves are clean, all endometriosis has been removed, because that endometriosis was sitting and damaging that nerve for the last 5, 10, 15 years. There's some areas that may not fully recover, but that doesn't mean that all is lost. It just means that we need to go to next steps. And next steps is treating the nerves, rather with medication, with nerve injections, with hydrodistension. We have some really great physiatrists that we use, in the DFW area. A physiatrist is kind of the one that I typically refer to as Dr. Rusha Kapadia, and she helps me evaluate the patient from a nerve perspective. She's evaluating the nerves of the pelvis. She's looking into that central sensitization of pain, how your body responds to pain, what your body does with these receptors, and how to downregulate them. And then also try to help the nerves heal with some hydrodissection or nerve injections, depending on where they're located. Next, we talk about hormones. So after surgery, hormones can be all over the place. And I think that this is really important to talk about. And many times we don't talk about that. Women, after the first month or two after surgery, sometimes in this first immediate time frame, they have irregular cycles. So their period can come early, it can come late, they can skip a period. Typically, by that third cycle after surgery, you are back to your baseline. So remember, endometriosis excision surgery will not change your cycle regularity. That is more related to rather PCOS or your hormone fluctuations. So at 3 months after surgery, your cycle will go back to how it was before. If it was regular every 28 days, it should be about 28 days. If you have PCOS and you're having one every few months, well, it may ultimately go back to that, because that's more of a hormonal fluctuation with your ovaries rather than endometriosis affecting that. But after surgery, remember that I talked about you have this huge cortisol response, you have this stress response. That is a hormone. And that's one of the reasons why it affects your cycle, because hormones all work together. They're released, they go to your brain, they go to your pituitary, and ultimately then you get a response from these fluctuations. So your cycle may be a little bit irregular that first month. Some women also notice depression after surgery. It can be especially common after hysterectomy. You have these post-hysterectomy blues, and it's important to talk about. It's also important to make sure that women know that they're not alone if they feel these symptoms. Is this normal? Is this expected? It is not common, but it certainly can be normal. And so being able to identify that quickly, like, hey doc, I'm a week out and my pain is better, but I'm really feeling sad. Like I can't stop crying. I'm frustrated. I'm short with my family. Or my friends, talking about that and trying to nip that early, whether it's trying to get them into some counseling or starting some medication, or just really just letting them know that they're not alone, that this is usually short-lived and it does resolve with time, but it is really important for patients to understand that sometimes these hormonal fluctuations after surgery can affect mood. And just letting them know that this is not, this is a part of normal healing process this will resolve. This is not going to be your new long-term, um, you know, emotional status. With that comes the mental health factors of surgery. Sometimes women after surgery, they just feel elated, like they're feeling better. They're excited for this new start in their life. Other people do have these emotional side effects, rather they continue to have pain and they're worried that their pain is not going to resolve, and what their next steps are. Again, mood changes, a lot of them are not anything you can control. You have these cortisol stress response, it's your fight or flight, and it takes a while for your body to come back down, to get back to a normal baseline of the hormone fluctuations. So experiencing these post-op does not mean failure. And that's what I want to reiterate here. Feeling pain after surgery, feeling emotional changes after surgery, having irregular cycles after surgery, that does not mean failure. That just means we need to look for next steps and make sure that we're treating you as a whole. Again, this is a marathon, not a sprint. I had a young woman come in to see me a few weeks ago, and she came in thinking that she needed a second surgery. And sometimes that's true. Sometimes you do need second surgery, but when I do surgery, I try to be very aggressive. I want to do it once, and I want to do it right, and I want to make sure we don't miss anything. Like I said before, even with the most aggressive endometriosis surgeon, an excision, there is a chance of recurrence. But this patient specifically came in and we talked about some of her symptoms, and really we just needed to implement this multidisciplinary approach plan. And she's been on it now for the last month or two, and she's seen a benefit. I'm not saying that she may not need surgery again in the future, but she didn't have the tools to implement this anti-inflammatory, like whole body treatment. And when she started to do that, when she got into physical therapy, when she changed her diet, she went into acupuncture. She started to see some of these benefits. This particular patient also, we talked about, the high risk of adenomyosis that they saw during surgery. And so we've at least talked about hormones or potential hormone treatments, for the adenomyosis, hoping that she doesn't immediately need another surgery. And again, everybody is different. I say trust your body and know your body. Trust your instincts. If you're telling me your endometriosis is back, I believe you. You had to advocate for yourself. You know your symptoms. You know your body, and so I think it's really important to listen to the patients, to advocate for them as they're advocating for themselves. If they tell me that something doesn't feel right, I believe them, and when we figure out a plan and we figure out next steps. So your body isn't broken. It just needs proper support and not blame. And this is very difficult when you've been fighting against this uphill battle for a long time. But remember, your body is not broken. It just needs proper support. And we're here to try to help you along the way. It is not easy. This is a marathon, not a sprint. But treating your body with this multidisciplinary approach is going to give you your best outcomes. All right, so I'm going to go back to the chat again. One thing I wanted to mention is that just about the Endometriosis Center of Excellence. So we are here, we are Dallas based. I am the medical director, Dr. Rachael Haverland. I am endometriosis excision surgeon. Um, there's so many women out there that need help and need treatment plans. We're not going anywhere. We are here in Dallas and we're here to stay. And we want to try to treat as many women as possible. We've had hundreds of patients come through Endometriosis Center of Excellence already, and we haven't even been open a year. We try to give, our goal is high quality and evidence-based care with a personalized approach. During this webinar, we will post a link. So the link is a way to ultimately get scheduled with our office. So there's a few ways that you can get scheduled with our office. One is that you can just call our office directly. Two, you can fill out the website form with your information. Three, you can click on this link that will be implemented into the chat. Now, I want to make sure that you understand this link on the chat will set you up a phone call with my scheduler. So this is not a direct meeting with me. However, this is a meeting in which you will talk to my scheduler and then be put on the books. At that visit, you'll be able to input your insurance information, talk to her about options or when to schedule, rather doing an in-person or a telehealth visit. But here is, they just put it into the chat, so you can book a call with our scheduling team. So if you click that link, you'll be able to schedule a call with Cyrus. She is my scheduler, and you'll be able to talk to her about the best time to meet with me, give your information, talk a little bit about what booking a clinic visit looks like. All right, and so a few more questions here, talking about where the time frame between a consult and having surgery that changes some throughout the month. Right now, we're scheduled out about 8 to 10 weeks for surgery. If it's we do have cancellations and openings that come up. People have lives. Rather, one of my patients got the flu a few weeks ago, and so her spot was canceled, and we moved her to another time frame after she was well. Other patients, some of my patients get pregnant, before surgery, which is awesome. There's a lot of reasons why patients need to move around their surgeries. And so we do have a waiting list, and we do have spots open all the time. So it's not super black and white as to exactly when your consult visit will be as to when your surgery will be, but that's about when we're scheduled right now. And I am trying to get in as many as I can. I see the benefit of surgery. I see the benefit of a multidisciplinary treatment plan. And trust me, I'm working my booty off to try to get to all of these patients. You guys deserve it. You deserve high quality care. Many patients have been gaslighted, or not listened to, or not taken seriously, or trying to get pregnant or just improve their quality of life. And I'm here for you. And I'm trying to get through these patients and surgeries as fast as I can, but also not losing the quality aspect, because it is so important for you to have a good experience, to make sure that we are treating this endometriosis and treating you as a whole, so that we can get better outcomes, so that hopefully this is not something that's negatively affecting your life going forward. Hopefully something that you can manage, and that it doesn't negatively affect your daily functioning. All right. Next, we're going to talk about optimizing long-term results, how to heal your life, not just your organs. And there's a misconception that surgery is the finish line. I'm a surgeon. I love surgery. I see the benefits of surgery every day. When I go into surgery, I am so laser focused on finding the endometriosis, excising all of the disease, getting wide margins, because I truly see the benefit of surgery. But it is not the finish line when it comes to endometriosis. Endometriosis is a whole body inflammatory disease that is lifelong, unfortunately. And so, yes, Surgery is so beneficial by going in and removing the underlying cause, the underlying etiology of the symptoms. But then we have to let your body heal. We have to retrain your pelvic floor. We have to let the nerves heal. Some of those inflammatory processes, even after the endometriosis has been excised, may not change. Some people still notice like elevated inflammatory markers, even though we did a full, thorough excision in their lab results. And it's just showing us again that endometriosis is very much a whole body disease. So working on decreasing the inflammation that our body receives and how it responds. Women with endometriosis tend to have more food sensitivities. And so sometimes it's food and diet, sometimes it's exercise, sometimes it's physiatry with nerve injections and down regulating the central sensitization of pain. Sometimes it's pelvic floor physical therapy. Usually it's a combination of all of these things. And lastly, we talk about hormones again. Hormones are not wrong. Some people have tried hormones and have terrible side effects, like birth control pills or progesterones. I'm not here to say that you should keep trying and failing multiple medical options, but some women do see a benefit from hormones, especially when it comes to adenomyosis. It decreases the amount of bleeding. It decreases the amount of pain that they have with their cycle. And so I think, again, this is where the individualized approach comes in, but it is not a one size fits all. And I do want to make sure that hormones are at least discussed as a treatment plan. Theoretically, it helps suppress some of the endometriosis cells. Yes, endometriosis can make its own aromatase properties and make its own estrogen. But that's not the case for everybody. Some people do see a benefit from progesterones or traditional birth control pills or an IUD. And so I do always talk about those as an option, especially if my patient has a higher risk for having adenomyosis and some of that inflammation of the uterus. So surgery is not the finish line. That it is the marathon. We have to give ourselves grace as we're healing and understand that we need to treat the body as a whole. So we talk about nutrition. I usually recommend a whole foods diet. Nutrition is tough because you don't see that immediate positive feedback. A lot of times you have to change your diet for a few months before you do notice the change of the inflammation or how your body is processing these foods. But I like whole foods diet, which is just fruits and veggies that look like they came from the ground, lean meats, and then adding or subtracting things from your diet to see what is affecting you. Is it gluten, or is it just like complex carbs like breads and pastas, or is it dairy? Some people feel that soy is somewhat of a inflammatory food. And so it's just everybody responds differently. I wish that I had a diet that was perfect for everybody to use, but your body does not respond the same as somebody else's body. And women with endometriosis, their bodies tend to be more sensitive. And so it's really important to understand how food can affect us. Does it make the endometriosis go away? No, but it helps with the inflammation. Diet is not going to be the only thing that you can use to treat your symptoms, but it is a very important aspect of this multidisciplinary treatment plan. Next, we talk about pelvic floor physical therapy. And out of all the things that I'm discussing today, pelvic floor physical therapy, I think is one of the most important. When your body is in pain, when you've been living in pain for as long as you have, your pelvic floor usually does not function well. You have painful bowel movements, you have bladder irritation, can have pain with intercourse. Your nerves run in your muscles. And so when your muscles are tensing and not functioning well, it's flaring your nerves. And your nerves tend to be more hypersensitive. And so this is a snowball effect of the pelvic floor and how its response to pain. And pelvic floor physical therapy can be incredibly important in helping reverse some of those long-term sequelae from the nerve damage and from the muscles and the pelvic floor, this dysfunction that this endometriosis is causing. Pelvic floor physical therapists are worth their weight in gold. Luckily, we live in DFW and we have some very good resources here. There's also websites where you can go to put in your zip code and try to find a local pelvic floor physical therapist that's closer to you. Recently, there's been some passing of laws that says you may not even need a referral for physical therapy. And so that may be something you could even do on your own without a physician prescribing it, is to go and find a pelvic floor physical therapist near you. You know, we also talk about the emotional changes that happen with surgery. Rather it's this, response with the cortisol, short-term depression, hysterectomy blues, just stress, knowing is this going to, I'm still having this pain after surgery. Is this going to be my life forever? Is this going to continue? Having a really good support group, whether it's family, whether it's friends, whether it's social media, other women with endometriosis that make you feel not so alone. It is imperative to have this support group and understanding of each other. And so when you feel down, when you feel like something's not right, whether it's me that you reach out to, whether it's a friend, it's important to have this kind of social circle of support. And then we talk about lifestyle adjustments, rather it's exercise, we talked about nutrition, sometimes introducing acupuncture or dry needling or other ways to treat your overall inflammation. Physiatry, again, I think is very important. Here in DFW, I typically recommend Dr. Rusha Kapadia. She's excellent. She evaluates you in a holistic approach and gives lots of treatment options and plans. And so, surgery is kind of is the start to clean out the pelvis, to remove the underlying etiology, to give your body a fresh start, but it is not the finish line. We have to continue this multidisciplinary approach long term. So one client that I had recently, they integrated postoperative yoga. They got a counselor. They started having mental health supports, food tracking. And what's funny is she didn't change her diet substantially. There was just a few things that she tweaked with her food tracking, and she met with a nutritionist, and she felt in control. She told me that for the first time in years, she felt in control of her body. She could help control her flares when they were going to happen, make them less common. This was a patient that did not want to try hormones, and that is completely fine. In my practice, I believe very strongly in autonomy and you making decisions, for your body. And so if hormones, if you've tried in the past and don't work, or if it's just something that you don't want to do, that's completely fine. And I support you. But she used this kind of holistic multidisciplinary approach with yoga. Again, she had a psychiatrist she had a psychiatrist and another mental health provider that she used and started food tracking, and she feels in control. And I don't think we can ask for a lot more than that, especially when endometriosis takes so much away from us and controls so many aspects of our lives. If we can implement these less invasive approaches and feel control, I think that is the ultimate goal. So recovery isn't about fixing you. It's more about restoring you, letting your body grow and heal and evolve from where it was before, whereas endometriosis was controlling you with inflammation. Hopefully after surgery, we can find that piece of being in control and restoring our body back to a place that is even better than baseline. That's the ultimate goal. All right. So now you clearly understand recovery and how to support yourself. We talked about many things throughout surgery, kind of what to expect the first day, what to expect the first week, what things that are not common, like fevers or new onset nausea, vomiting, what things that are common when you can still have flares or your pain can get worse over those first few weeks, when you can still have nerve pings and zaps, when you can still feel tension in your pelvic floor, kind of what next steps are. Again, nerves heal very slowly. They heal 1 to 2 centimeters a year. This tissue remodeling can take up to a year after surgery. And so, remembering that surgery is not the finish line. It is the first step to removing the underlying etiology and then letting your body heal, letting your body be restored. It helps preserve your ovarian function, which gives you longevity, helps remove the inflammation so that it gives your nerves and your muscles a chance to heal. But even with this knowledge, it's easy to feel lost without a step-by-step plan. So can I take just a few minutes to show you how we can walk with you through this and create a customized recovery roadmap that fits your life? And so with surgery, we give you some of this roadmap. So a personalized recovery timeline. So based on your surgery date, symptoms, personal needs, you can reach out to me anytime. What is improving? What's not improving? What do we do for next steps? When you meet with me for the first time, you get an email with a multidisciplinary approach talking about some of the steps that we need to implement, whether it's nutrition with whole foods diet, pelvic floor physical therapy, acupuncture, hormones, physiatry, just trying to give you all the tools that you need for this marathon of long-term recovery. So a holistic pain management plan, medical, nutritional, therapeutic options. I give you 3 different pain medicines after surgery, including a nausea medicine. I also give you a long-acting numbing medicine in your incisions, but sometimes we need long-term inflammatory. We talk about turmeric, vitamin D, using acupuncture to help with some of that, chronic pain and inflammation. We do an emotional and hormonal reset toolkit. So understanding that you do get hormonal changes after surgery. You get these big surges of hormones, your cortisol goes up, trying to make sure that you have a concrete core of support after surgery, whether it's the hysterectomy blues or after endometriosis surgery, depression, feeling like, you're worried that your pain will continue forever and then it may not resolve. So access to counseling, resources. I can refer you to other OBGYNs that do hormone testing, self-regulation techniques. And then, we have private check-in sessions. You have my cell phone. You can text me, you can call me. I'm not always immediately available sometimes when I'm in surgery or I'm in clinic, but I will call you back, within the next day or two. I want to make sure that we review your progress and what's improving and what's not improving, but also using this multidisciplinary toolkit to really give your body this long-term relief and the long-term plan. If you don't walk away feeling more confident and clear about your recovery, your consult is refundable. And so I want you to feel very comfortable with the treatment plan that we put in place. And again, it is not a one size fits all. Everybody responds a little bit differently. So I'm going to ask a few more questions in the portal, in the chat. Remember, if you want to book a visit, you can call us. You can fill out the website contact information, or you can also use this link here. This link will set you up a phone call with my scheduler. So this is not a direct visit with me. This is a visit with my scheduler. She'll go over your insurance information and she'll be able to talk to you a little bit more about scheduling and sort of what that looks like, what dates are available. And so you can also use this link to meet with my scheduler to talk about getting a visit with me. But again, this link is to meet with her to talk about getting a visit with me down the road. And there's many ways to get a hold of us, but I would be honored to see you. Thank you guys for sticking it out with me over this last hour and kind of talking through postoperative recovery. I'm going to answer some questions that are in the chat. How long will I be in pain after surgery? So the worst pain is usually, like I said, the first night and then the next 48 hours. Most people still feel bloating and sore for at least the next few weeks. Sometimes it may take a full 12 weeks to get out of surgical pain. Now, your endometriosis pain or the pain that you had before surgery, sometimes that can take longer to resolve as we let the nerves heal, as we let the tissues remodel. So remember, do not lose hope. Give yourself grace as you're healing. We just need to look towards next steps to make sure that we're giving our body the best chance to recover and to heal. Another question I had is, when can I go back to work or exercise? This is a little bit different for each patient. I usually say you can go back to work after a week if you're working from home, 2 weeks if you're working from the office. If you have a physical job, you may need up to 4 weeks before going back. Like if you're a nurse moving patients or moving boxes or moving heavy loads, you may need a little bit longer, or you can go back to work using, with some restrictions. Ultimately, we are very used to working with you. If you feel like you're not ready, we can give you more time or go back with restrictions. But it is important to give your body time to heal, and just letting your body recover the best that you know how. Exercise you can start to implement around 2 weeks. Just listen to your body. You can increase your weight, you can increase your activity. And then at 4 weeks, there's really no restrictions for exercise. But between 2 and 4 weeks, you just listen to your body as you're starting to become more active. What if I'm still bloated after surgery? Remember, bloating takes a while to resolve. That is a response of inflammation. That's response of your bowels recovering. And so it can certainly take a long time for the bloating to resolve. Most of the bloating goes away within 2 weeks, but sometimes it does take like even up to 3 cycles for the bloating to improve. Some of that's related to the endometriosis. It can be related to adenomyosis as well, or constipations of the bowel. So there's different reasons you may continue to feel bloated, but it's important to try to evaluate which one of those is causing the symptoms. Let's see. This patient says, I have stage 4. She lost her right tube and ovary. She has endometriosis, adenomyosis, and fibroids. Can I have a hysterectomy? I'm so sorry you're having to deal with this. Endometriosis is debilitating, commonly associated with adenomyosis. Fibroids can also cause inflammation of the uterus. Um, this is a personal decision, but the gold standard of adenomyosis treatment is a hysterectomy. Not endometriosis is treated with excision surgery. But if your quality of life is affected and you're in pain, I think it's important to have a discussion of the pros and cons of hysterectomy for treatment of the adenomyosis versus endometriosis excision. Talking about a multidisciplinary plan. Let's see. When is optimal time after excision surgery to try to conceive? So the evidence is the first 6 to 9 months after surgery is when you're going to have your best outcomes, both for natural conception and with IVF. For my patients, as long as I don't remove a fibroid, they can start trying the same cycle or the next cycle whenever they feel ready. That's when you're optimized. And I want to take advantage of that time frame after surgery. If you have a myomectomy, you need to wait 3 months at minimum before trying to conceive, since there's a suture on the uterus that needs to heal. Everybody is different. The first step is making sure that all endometriosis is removed so that environment of the pelvis is optimized, because if not all endometriosis is removed, if you have a ablation of the endometriosis or cauterization, there's actually no improvement in pregnancy because the endometriosis really hasn't gone away. And so it's important to make sure the first step is that all endometriosis is excised so that you get your best outcome. And somebody now. I love that. I love that patients are helping advocate for each other and knowing some of the answers. Thank you guys for meeting with me. I hope you learned a little bit today about, postoperative recovery expectations. I want you to leave with clarity, validation, and a practice map for navigating life after endometriosis surgery with fewer fears and more tools. You are never meant to figure this out alone. This webinar hopefully will help you recover with confidence and understand some of the next steps. I'm Dr. Rachael Haverland with Endometriosis Center of Excellence. I'm honored that you spent the last hour with me learning more about endometriosis and surgical recovery. And I want to advocate for endometriosis as much as I can. I want to keep learning as much as I can about endometriosis, but also continue to advocate for you as patients, just helping you understand a little bit more about some of your treatment plans and treatment options, but also surgery, and remembering that if you continue to have pain after surgery, it is not a failure. We just have to look towards next steps. So I'm here for you. I would love to meet with you in person for a consult if you haven't already. Again, you can click the link here to meet with my surgery scheduler. So the link will give you a meeting with my surgery scheduler to talk about scheduling an appointment with me. You can also call our office or fill out our contact form. But I look forward to seeing you in the future and helping you regain your quality of life. Anyways, y'all have a good rest of your Wednesday. Thanks again for meeting with me, and I hope I see you next month at our next webinar. Bye-bye.